I welcome you all in the video tutorial of pharmaceutical biotechnology. So students, in this video tutorial we are going to cover again unit number 3. We have started topic number E, that is the storage conditions of vaccines. So let's start about the different storage conditions pertaining to the vaccines. So how vaccines are stored? Yes, you are all right. Cold chain method. So the cold chain is a system of storage and transport of vaccine at low temperature from the manufacturer to the actual vaccination site. Suppose आपने वैक्सीनेशन प्लांट है कसौली में और आपने वैक्सीनेशन सप्लाई करनी है कर्नाटका में, कैसे लेके जाएंगे? There are different methods. There is a particular word we are using is the cold chain. So the cold chain is a system of storage and transport of the vaccine, storage as well as the transport of the vaccine at the low temperature. Low temperature conditions हमें maintain करनी है. And the cold chain system is necessary because vaccine failure may cause due to failure to store and transport under strict temperature controlled condition. तो vaccines के लिए हमें strict temperature controlled condition को maintain करना पड़ेगा, तभी हम उसको उसकी appropriate vaccination site पे हम उसको पहुंचा सकते. Then why the cold chain is required? Yes, cold chain is required because we have excessive heat, temperature condition is there, जिसकी वजह से वायरल अपनी पोटेंसी लूज कर सकती है. अगर जनरल सेंस की बात करें तो जनरली ऑल द वैक्सीन लूज पोटेंसी ऑन एक्सपोजर टू हीट अबव +8 डिग्री सेल्सियस. अगर 8 डिग्री सेल्सियस से ज्यादा, हम जनरल बात कर रहे हैं, इसमें वैक्सीन के अलग अलग टाइप हैं, जरूरी नहीं है कि ये सभी के लिए लाइन सही है, बिकॉज इन साइंस एक्सेप्शंस आर ऑलवेज देयर. सो सम वैक्सीन लूज पोटेंसी व्हेन एक्सपोज्ड टू फ्रीजिंग टेम्परेचर आल्सो, इसीलिए यहां पे फ्रीजिंग भी दिखाया हुआ है. अगर किसी वैक्सीन को बहुत ज्यादा फ्रीज कर देंगे तब भी वो डैमेज हो जाएगी, और दिस डैमेज इज इरिवर्सिबल. उसे हम रिवर्स नहीं कर सकते. इट इज वेरी वेरी इम्पॉसिबल टू डू अगेन रिवर्स इट. तो कोल्ड चेन इक्विपमेंट्स में क्या यूज करेंगे? वॉक इन रेफ्रिजरेटर यूज करेंगे, वॉक इन कूलर्स यूज करेंगे, डीप फ्रीजर, ILR बास्केट, डायल्ड थर्मोमीटर, कोल्ड बॉक्सेस, वैक्सीन कैरियर्स एंड डे कैरियर्स. अभी हम देखेंगे एक एक करके ये सारी चीजें क्या है. यस, यू आर राइट. रेफ्रिजरेटेड ट्रक्स आर देयर. Walk-in freezer, this is again walk-in cooler. Cold box is there, deep freezer, ice-lined refrigerator, that is ILR. Ice-lined refrigerator, that is ILR. Again, vaccine carriers are there, cold boxes are there, deep freezers, ILR of different capacities. And they are, if you talk about the walk-in cooler or walk-in freezer, so we have temperature range +2 degrees Celsius to +6 degrees Celsius, and walk-in freezer -15 to -25 degrees Celsius. So we can maintain easily store our vaccines. So walk-in freezers used for the bulk storage of OPV. What is this OPV vaccine? Now tell me. Yes, oral polio vaccine. So polio vaccine, that is the oral polio vaccine is OPV. तो यस, OPV वैक्सीन के लिए कौन सा यूज करेंगे? वॉक इन फ्रीजर्स. इट मेंटेन द टेम्परेचर अराउंड -20 डिग्री सेल्सियस एंड इट इज अवेलेबल इन डिफरेंट साइजेस. ओके, वॉक इन कूलर्स आर देयर अगेन फॉर डिफरेंट टाइप ऑफ वैक्सीन लाइक DPT, diphtheria, pertussis and tetanus virus, measles, bacillus, calming and guerin, BCG, hepatitis B also. So it can cater 4 to 5 districts also. Maintain temperature range up to +20 to +80 degree Celsius. This is very common in India. Refrigerated trucks are there. The vaccine delivery vans are there, which can maintain temperature up to +2 to +8 degree Celsius. Again, very common. Ice-lined ILR, that is ice-lined refrigerator, which can maintain the temperature conditions of +2 to +8 degree Celsius. And what are different type of vaccines which can be stored in this ILR is BCG, DPT, OPV, measles, tetanus, hepatitis B, etc. Okay. Then deep freezers are there, which has different capacities, different sizes, 300 liter to 140 liters, and it has a temperature range of -15 to -25 degrees Celsius. Then we have cold boxes of temperature range +2 to +8 degrees Celsius, and they are frequently been used for the transportation as well as storage of the vaccines like DPT, DT, TT, that is tetanus vaccine. Vaccine carriers are there. +2 to +8 degrees Celsius is the holding temperature. Nowadays we are using this ice packs as well as the foam pads are also very much used for the storage of the vaccines. So in this slide, there is a illustration of the vaccine vulnerable to the heat. So most sensitive to the least sensitive. You can see here. So this is the most sensitive vaccine which is vulnerable to the heat. Then OPV, and this is the least sensitive vaccine. Okay, this is the most sensitive to the heat, and this is the least sensitive to heat. This is the illustration of vaccine. Again, vaccine vulnerable to the freezing. So this is the most sensitive vaccine vulnerable to the freezing, and this is the least sensitive, that is the tetanus. So here again the summary of the vaccine vulnerabilities, that OPP vaccine is vulnerable to, it is very heat sensitive, it is also very light sensitive, but it can withstand freezing. Temperature range is given +2 to +8 degrees Celsius. So you can remember this chart also. Then again BCG vaccine, again it is very heat sensitive as well as light sensitive, but it can okay with the freezing, mean it can withstand freezing. And what is the temperature range? At primary health center, that is +2 to +8 degrees Celsius. Again DPT is there, which can relatively heat stable. Again temperature is given. So अगर हम वैक्सीन की स्टेबिलिटी की बात करें तो व्हाट इज स्टेबल वैक्सीन? अ वैक्सीन with a very long shelf life. A vaccine lot or vaccine particular lot that compiles with the release of specification throughout shelf life. जो वैक्सीन ज्यादा समय के लिए स्टेबल रहे, शेल्फ लाइफ जिसकी रिटेन रहे, उसी को हम बोलेंगे एज अ स्टेबल वैक्सीन्स. और इन स्टेबल वैक्सीन्स के लिए देयर आर डिफरेंट गाइडलाइंस पब्लिश्ड बाय WHO also, and there are several factors which affect the stability of the vaccines, like purity, formulation, stabilizers. We are using the different pharmaceutical frozen refrigerators or pharmaceutical ingredients like HAS, recombinant human albumin, etc. So the design of the stability study depend upon the objectives of the following objectives. That is, why do we do stability evaluation? For determination of shelf life, storage condition, for monitor vaccine stability, and to ensure proper manufacturing. And you know there are different type of stability testing, like real-time testing. We can do real-time stability testing, accelerated, and stress testing. Real-time means long-term stability under recommended storage condition for the shelf life proposed for the product. Accelerated testing is used under accelerated storage condition, in which we can accelerate the storage condition, and the stress condition is the most severe condition that used for the accelerated studies. Look at this time ranges. रियल टाइम में टाइम रेंज होगी 2 to 8. एक्सेलरेट करेंगे, अगर एक्सेलरेट की बात होगी, जैसे हमने देखा एक्सेलरेटेड टेस्टिंग में, वी कैन इंक्रीज द टेम्परेचर अप टू 15 ±2 डिग्री सेल्सियस. और अगर स्ट्रेस देने की बात होगी, अगर हमें वैक्सीन को स्ट्रेस देंगे, मींस टेम्परेचर कंडीशंस को हमें स्ट्रेसफुल बनाना पड़ेगा 10 +10 डिग्री सेल्सियस ±2 डिग्री सेल्सियस, एंड वी कैन इंक्रीज अप टू 35 ±2 डिग्री सेल्सियस अप टू, दैट इज द स्ट्रेस कंडीशंस. तो इन सभी कंडीशंस पे वैक्सीन्स की स्टेबिलिटी टेस्टिंग होगी. और वी कैन से दिस आर द कंडीशंस फॉर द इवैल्यूएशन ऑफ द स्टेबिलिटी ऑफ वैक्सीन्स. So I think this will give you a brief idea about different storage as well as the stability of some of the vaccines. So in the last, I acknowledge all the sources I have used to prepare this video. So thank you very much for your valuable time.